How can I make my eyelashes more visible?
Many people we see of Asian ethnicity express frustration about their appearance of not looking like they have eyelashes. This is due to the eyelashes being obscured by the upper eyelid skin. I'll discuss how I help my patients who want their eyelashes to be more visible and also make their eyes look brighter. I'm Dr. Amiya Prasad. I'm a diplomat of the American Board of Cosmetic Surgery and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in New York City and Long Island for over 25 years. I perform all types of cosmetic eyelid surgeries, such as treating puffy under-eye bags, drooping eyelids, and hooded eyes. I specialize in revision surgeries to correct complications from eyelid surgeries originally performed by other doctors. I'm also well known for Asian eyelid surgery or double eyelid surgery, where an eyelid crease is created for people who want a double fold for the upper eyelid. In addition to having less visible eyelashes, many people who consult me for double eyelid surgery say that their eyes look small and that they're unable to apply eyeshadow. In terms of Asian eyelid anatomy, the skin and soft tissue of the upper eyelids with no discernible fold can make the eyes appear smaller as well as obscure the eyelashes. It's generally understood that about 50% of people of Asian descent are born without a defined eyelid crease, so they have what's called a monolid. Asian double eyelid surgery, or creating an eyelid crease, helps to make the eyes appear more open, which also reveals the eyelashes and creates a space for the application of eyeshadow. Now, during a consultation, I routinely use a Q-tip to elevate the upper eyelid skin and show my patient an approximation of how they would look after surgery. I do this in a way that I feel is how nature would have created a natural eyelid fold if the patient had been born with one. As far as surgical options are concerned, there are two ways to perform double eyelid surgery. The options are incisional and non-incisional surgery. In both of these categories of surgery, the skin is being connected with sutures to the muscle which lifts the eyelid, called the levator muscle. Incisional surgery is performed when there is excess skin or fat that needs to be removed. If there's no need to remove skin or fat, I perform the non-incisional technique. I perform non-incisional Asian eyelid surgery by placing openings in the skin of the eyelid and passing sutures through those openings to engage the levator muscle, thereby creating an eyelid crease. I perform incisional and non-incisional double eyelid surgery using local anesthesia with light IV sedation. My patients appreciate avoiding the risks and recovery associated with general anesthesia. Aftercare is minimal, involving the placement of cold compresses for about 2 days and antibiotic ointment to the skin. Most of our patients return to work and other activities in about 1 week. So essentially, the take-home message is that limited visibility of the eyelashes seen in many Asian people is one of the characteristics of having the upper eyelid skin resting on top of the eyelashes associated with the presence of a monolid or the absence of an eyelid crease. In my practice, I approach Asian double eyelid surgery from an objective of creating a crease as if one had always been there since birth. I find that my patients like having a natural result where their eyes look brighter and the eyelashes are revealed. This further opens countless possibilities for the application of eyeliner, mascara, and other eyelash enhancements. I hope you found this information helpful, and thank you for your question.